Weight management is a journey, not something that happens overnight, as we just heard. So we're going to continue the conversation with Dr. Eric Wilson, a bariatric surgeon with the Cone Health Bariatric Surgery Program and member of the Cone Health medical and dental staff. So you just saw the story there where Dr. Wilson was talking about it. Let's kind of go back to like square one here. Let's talk about the health risks of not maintaining a healthy weight.
Yes, when someone suffers from obesity, they're at increased risk for developing high blood pressure, joint or mobility concerns, diabetes, sleep apnea, and even certain cancers.
All right, and just recently we learned of like Lisa Marie Presley's death and that she died from complications from bariatric surgery. So what can you tell us about the health risks that are related to this kind of weight loss surgery?
Yes, with any weight loss surgery or any abdominal surgery, there can be complications and bowel obstructions can occur. It's exceedingly rare to have a bowel obstruction after bariatric surgery, and even rarer to pass away from a bowel obstruction complication. I think the take-home message is that if you've had any type of major abdominal surgery and are having abdominal pain, then you should be evaluated. The likelihood of dying after having bariatric surgery is less than 1 in 1,000. And so we've been doing bariatric surgery at Cone Health for close to 20 years, and our mortality rates are less than national average.
Okay, and so the surgery, of course, is just one of the options. It's probably not the first option that people would go to. So let's talk healthy eating and exercise, so we don't even get to that option. We know that both of those, healthy eating and exercise, are important for weight management. But what are some things that you think can help us get on the right track?
Well, I think one of the take-home things to remember is any weight gain didn't happen overnight. So I think setting realistic expectations that any weight loss will take some time. And so I think working on your food choices first, starting with maybe perhaps lean proteins and non-starchy vegetables and complex carbohydrates. And then once you're consistent with that, then incorporating some type of physical activity, such as walking, or if you have mobility challenges, then maybe some type of water therapy.
All right, so it's kind of like baby steps, right? You can't just go cold turkey and expect everything to change. You got to change a little bit at a time. And definitely people want to see results quick. So what should we realistically look for when we start thinking about someone who's starting a health journey like that?
Well, I think, one of the first things that most people will experience once they start eating and changing their food habits might actually just how they feel. They may not see an immediate change in the scale, but they may feel more rested and have better sleep by just simply changing their food around.
Okay. Now we've heard lots of weight loss medications, that are becoming very popular. Some people see that they can drop pounds quickly. Is this a sustainable or recommended weight management tool for like long-term health benefits?
Well, I think one of the things to remember is that obesity is a disease, just like high blood pressure or diabetes, and we now have some very effective medications out on the market to help treat obesity in addition to surgery. But the take-away message with these new medications like semaglutide is that they're meant to be long-term. Generally, once the patient stops these medications, about 2/3 of patients will experience some weight regain. So these medications are meant to be more chronic and long-term.
So taking them the rest of your life kind of thing?
Potentially. Right now, that's what the studies are showing that we have completed to date.